there again. I'm Joanna, also known as Naturally Fine, and I'm sitting here. You'll see this little heat pack on my shoulder, kind of nursing a minor shoulder injury. So while I'm sitting here with that on my shoulder, I just decided to go ahead and talk a little bit more about my thyroid journey. I mentioned in my introduction that I've had thyroid issues the majority of my life, and so I have contended with that, and the biggest way that the thyroid has impacted me has actually been in my hair. And so the thyroid, for those of you that don't know, is pretty much a butterfly shaped gland that sits at the base of the neck. And so it's two sides, the left side and the right side. And so it pretty much controls almost everything. The hormones in your body, your metabolism. It's a factor when it comes to weight gain, weight loss, your heart rate, thickness of hair. And so it's a pretty big deal if you have a thyroid problem. And my journey started when I was 16, that young, fragile age of 16 in terms of self-esteem and teenage development years and all of that. And so I had a goiter. A goiter is Goiter is an enlargement of the thyroid gland, and it turned out that it really was just the left side that was enlarged. You can't see it now because I had it surgically removed 13 years ago. And so I was sick actually with a cold, and I noticed that my throat was swollen when I was 16, and I showed my mom, and she told me that if it didn't go away, then with the cold, because we just assumed since it was in the throat area that it was associated with the cold, then we get it checked out. And so it didn't go away. We got it checked out, and that's where I learned about a goiter and a little bit more about the thyroid. And I was familiar somewhat with thyroid illnesses because in the 92 Olympics, one of the female sprinters, track athletes, they did a feature on her, Gail Devers, and she talked about her journey with Graves' disease, which is a thyroid autoimmune disease. And I didn't realize that I would later experience Graves' disease, but when the doctor mentioned thyroid, I was like, uh-oh, that's the same thing that Gail Devers had. So this just fell off my shoulders, so I'm just putting it back in place. But anyway, so for the most part, it was more of a appearance issue for me. It wasn't causing me too much of a problem, but I would button up the top button or wear turtlenecks when it was colder outside just to cover it up. And so I was self-conscious about it, but I was pretty much told that there was no need to deal with it. And so since it wasn't really causing any other problems, to try to remove it would solely be cosmetic. So fast forward a few years, when I'm in college, I experienced a scare, actually a cancer scare of all things. My thyroid seemingly started causing problems. My heart rate was accelerated. I had my period 3 times in 45 days, and I started to think back to Gail Devers, and I was like, what's going on? So then I started seeing an endocrinologist, and because it was basically an enlargement, a mass, they said we can't rule out that this isn't cancer, and so until we actually test it. And so they were pretty sure it was just an enlarged gland because that's what a goiter is, but you just never know. So I think I was in a 5-year program, so I think it was my 4th year in school, and so I had to have a biopsy on my thyroid. It was a fine needle aspiration. So basically they stuck a needle in my neck and withdrew fluid. And it's not the same as having the actual tissue tested, but that's what was readily or easier to do at the time. So I had that done, and it came back benign. But what what we discovered was that I had elevated antibody levels, and it still wasn't fully impacting me, but that was, even though I had those other symptoms, it was just something that we had to monitor and watch. And so, but antibodies are a part of the immune system, and they help fight off disease, bacteria, infection, all those types of things. And so, to me, the way I understand it, antibodies are attached and associated with all of our different organs and major systems. And so there's antibodies associated with the thyroid and to fight off and ward off disease. But my antibody levels were high. They were elevated. They were beyond high. They were off the charts. And so that was an indicator that I had an autoimmune issue. So in essence, that's when the body turns against itself. So these elevated antibodies didn't have anything else to do. So what they did was attack the thyroid. So when I was finishing up college, it hadn't gotten terrible at that time. But like I said, it was something to monitor. And I still had the goiter. And at that time, they just kept telling me the only reason to remove it now would be simply cosmetic. And I was like, okay. Well, fast forward a few more years, and I'm working full time, graduated, and a couple of men that I worked with actually had thyroid cancer. And so that got me thinking about my own situation. And then not long after hearing about these guys' stories, I had somewhat of a vision. So that space in between sleep, but you're not fully awake. I had this vision of myself looking in the mirror and like a camera panning up from my feet all the way up to the neck area. And I was like, I'm sick of this thing. And I was like, okay, I guess that's a sign that I should perhaps consider getting this removed. And so I started that process, went to a ear, nose, and throat otolaryngologist surgeon, and we had the procedure done. And because they would now have the tissue in hand, they had to do a full biopsy, and so they sent it down to the pathologist while I was under, because like I said earlier, it was just the left side, but if it turned out to be cancer, they were going to have to take out the entire thyroid gland. And so it came back benign, thankfully, and my right side pretty much provided all of the thyroid hormone that I would need, and I was doing fine for several years. And so fast forward 8 years, but I would get tested every year. Fast forward 8 years, and I had an injury to my foot that I was supposed to have surgery on to correct. And I'm all IV'd up, getting ready to go into the operating room, but my heart rate was just out of control. It was what they call tachycardia, so it was elevated. It was just going fast, and it simply would not slow down. And so my surgery was actually canceled right there within a half hour of my scheduled surgery time. And I had to go see a cardiologist, get checked out, make sure it actually was not an actual heart problem. So then I was tested for every single thing that could possibly cause tachycardia, elevated heart rate. And since thyroid was something that I already would have checked, and I actually had it checked earlier that year and things were normal, so something had happened within 8 months. And when my thyroid level results came back, they were off the charts, completely overactive. And so, but along the way, how that fits with my hair was that I would notice that I was shedding a lot more hair, and more than the typical amount that the normal person sheds daily. And I didn't fully make the connection, but that was just in hindsight where I could see how the thyroid really impacted my hair. So I went through additional testing, and that's where I discovered that I, in fact, had Graves' disease. And actually, back when I had the left lobe taken out, the pathologist confirmed that it was the other autoimmune disease for thyroid called Hashimoto's. So, name for the guy that discovered it. So anyway, it's rare, not unheard of, but rare for one individual to actually have both autoimmune diseases. So I had Hashimoto's for a period of time, and then the right lobe that remained ultimately succumbed to Graves. And I had to be treated for that with radioactive iodine, which basically renders the thyroid useless. It doesn't kill it completely, but it renders the thyroid useless, so I was in a hyperactive state with an elevated heart rate and thinning hair and losing hair rather. And then I went into an underactive state because it's easier to control through medication underactive, whereas in an overactive state, you're putting yourself potentially in life-threatening situations with elevated heart rates and all of that. So when the thyroid is underactive, the hair just is not responsive. And so even though I was coming back, my results were coming back in the normal range, I wasn't convinced that it was in the optimal range. And so because I was tested every year since having the left lobe removed, I went back and looked to see what my levels were when things were fine with me. And so I've since worked with my doctor to adjust my medication dosage such that I get back to how it used to be. And I'm hopeful that now that I've been on this new dosage, that in a couple more months, perhaps my hair will rebound and I will see thicker hair or more dense hair. My hair is fine, the diameter of my strands, that's not really going to change. So I'd have fine hair, but my hair will be fuller perhaps and more dense, and so I wouldn't be as worried about those thinner spots in my crown. So I'm very hopeful. But I guess if there's a takeaway, if you have a thyroid issue, there's a wide range for what's considered to be normal. You want to find yourself in that optimal range such that the symptoms associated with thyroid disorders are minimal to you, and that is possible. So you may fall within normal, but is it actually optimal? Because without that, particularly with the hair is not going to respond to any other type of treatment that's out there. And I've tried almost everything, well, not almost everything, but a lot of stuff to try to thicken my hair. And if there's an underlying problem, it's just not going to respond to those other treatments. So we'll see in a couple months, after now being on a new dosage, what will happen. I think I have to give it at least 3 to 4 months to see how my hair responds. So I will definitely be on here, and you all will see the results as it happens. So that's all for now. Until next time, have a good one.